I have to say, this is the most difficult part for me. And not because I'm a man, obviously, but it's because the data is all over the place. Still struggling with getting products approved. Even the definition of female sexual dysfunction is more complex. Obviously, with men, we're looking at an erection. It's a mechanic thing, right? We're measuring, you know? In females, obviously, it's different. It's about arousal, orgasmic function, vaginal health and dryness, et cetera, stimulation. So there are many factors. And believe it or not, different studies have defined that sexual function in women differently. So the FDA has had trouble pinpointing one good measurement tools, that gold standard for female sexual dysfunction. But it's getting better because at least we have one product approved that opened the door. It's not a very effective product, but at least it got approved. So I think that discussion about female sexual function is increasing because of that. We needed a product approved. I'm sorry, this is a little busy, but in at least in one reference, 43% of American women suffer from sexual dysfunction, over 50 million or more women. Highest proportions between 18 and 29 young women. Why? Because they're also having more sex too, and they're before the childbearing years. But also older women have, especially postmenopausal women, have a lot of problems. Many women can reach orgasm with the clitoris being stimulated, but only half of the women regularly reach orgasm during intercourse. I saw a Netflix special on this, researchers and women and female activists talking about this, and many women in that special have never had an orgasm. They just didn't even know what it was. And it was basically all related to the male lack of ability, because it really is, about clitoral stimulation. So that, for me, in the whole special, was the main point I got. The fact that males suck at stimulating women. Males suck at making a woman comfortable and connect spiritually and intimacy-wise with women, which is part of this arousal. There are many things that we as men are doing wrong when it comes to, and we tend to be a little selfish, and we tend to reach orgasm quick and not do our job to make sure that's not the case. So we're not the first ones, but the last ones to reach that point. So it's very complex. And I do have to say that women have also been very understanding and polite, because obviously nobody wants to judge about reaching orgasm sometimes when they didn't. So that was also very evident in that series that I saw, the fact that some women are compelled to have to lie just not to hurt their partner's heart, you know, about their performance. So, and a lot of women in that program found orgasmic pleasure by themselves with, you know, toys and all that, because they actually could stimulate their clitoris. So I was fascinated. I thought it was an amazing special. If you can look into Netflix, because it's not only talking to doctors, but ladies that have been activists. They're activists now. And you were telling me how that whole world, you may want to say some of that.
At the NAMS that did a documentary on Netflix.
Yeah, so it's actually not only the fact that we are, as sexual partners, are failing women are not speaking up as much, because obviously there's a male ego. and as I said, sexual performance anxiety it tends to be associated with judgment, and that's an issue. So there are different variables in the female sexual functions: a desire disorder, libido, lack of libido, the arousal disorder, a persistent inability to attain or maintain sufficient sexual excitement, an orgasmic disorder, persistent difficulty, delay, or absence of orgasms after sufficient stimulation, and pain disorder, persistent genital pain associated with sexual intercourse. So there are many factors involved. Sometimes, you know, after, obviously I've been working in this field for a while, and sometimes I wonder that having sex, a good sex, and in great performance for both partners, it's almost a miracle. There's so many variables involved, not only mental, physical, medications, stress, judgment, taboos, that it is almost, it's an amazing thing that when two people can have good sex where both reach orgasm and both are stimulated and happy about it. If you have that in your life, embrace it. Take care of that other person because it really is not as common as people think. You hear from your friends that everybody's having fun, but sometimes you hear more stories than what they're worth. I'm sorry, I got a little distracted there. But obviously, yeah, I'm a gay man, by the way. So, but I did date women very successfully till I was 24. So I know a little bit of that. But I also know as a gay man, I kind of take the female side too. I can explore the fact that I'm a feminist in many ways. So I do think that it's both ways. So anyways, let's not get too into that because makes some people uncomfortable. Although, you guys are young. You don't have the hang-ups we used to have back in the days. So menopause is obviously an issue there. Vascular disease, high blood pressure, diabetes, pelvic trauma, just like men. Basically, we're humans. We have the same issues when it comes. Fluctuations in the level of estrogen and testosterone hormones could be a cause of sexual dysfunction. Obviously, a fluctuation occurs monthly and during pregnancy that can affect sex drive. In postmenopausal women, sex drive may be reduced because of estrogen levels decrease. We do have some products and creams that can deal with that. Sex drive may also be reduced in women who have both ovaries removed for obvious reasons, hormonal issues, basically. A reduction of sex drive may result from anxiety, depression, etc., problems in the relationship. Kids, being tired, taking care of kids is a big problem. In my world, I used to do a lot of research. We used to complain a lot about the fact that we don't have enough women in any studies about anything. We used to do HIV research, immune research, all that. Where are the women? There's only 10% women. The world is not 10% women. We're not doing enough to bring women in. Where are women? And after studies were done in the sociological aspects, they found out that women were taking care of people. They didn't have time to go to study. It really wasn't about not wanting to join a study. It was basically their ability, time-wise, to join a study because it's a luxury for a lot of women. And so the studies kept bringing basically childcare, all that stuff, transportation, doing things to minimize. But I think we got the maximum we ever got to was 20%. So that happens too here when it comes to female sexual function. All right, so breast cancer survivors too have a lot of issues. Testosterone for women, and compounding is the only source of testosterone product for women. A company tried to approve a testosterone gel like 10 years ago. Libby gel was called. I was very hopeful. I thought, oh, wow. Yeah. But they did not get approved. They didn't meet the endpoint because the endpoint was really based on an endpoint, a definition of sexual harassment that was poorly defined. So the company basically let it go, which is good for the compounding industry because we're the only ones providing this treatment for women, which we have good data. It's not like we don't have data on the fact that it improves sexual libido mostly. And very low doses, obviously, not like men, 20 milligrams subcutaneously. Pellets can also work, and Empower is going to get into pellets January-ish. Combinations not only with testosterone, but estrogen, progesterone, DHEA. We're not only talking about one hormone sometimes that can be provided for women. And side effects, too much testosterone, masculinization, fuzzy peach hair, like peach fuzz hair. Or did I get that wrong? Little hair, mustache. What do you call that? Peach fuzz? Peach fuzz hair. Clitoral enlargement, menstrual issues, basically amenorrhea, either too much menstruation or menstruation has actually ceased to happen. So, but those are, the dose is too high. So obviously all the doctors prescribing female testosterone and other creams here are doing so because they're very educated. This is not an easy field to get into. We will have a training session with a physician that does basically female-related sexual health and products.
The sweet spot for women for testosterone that these doctors are targeting is about 10% of a male. So the sweet spot for optimal testosterone for a man is roughly 600 to maybe 1,200 nanograms per deciliter of total testosterone. For a woman, it's somewhere between 60 and 120. And that's the top range. And one thing I'll share with you, which is why a lot of these doctors have been doing this for a long time, know more than what's out there in the data. But most women that I've had the opportunity to screen, being on the clinic side, which is hundreds and hundreds of them, even in their 20s, have very low testosterone. And we don't, and it's mostly American women. There's not anything official on that, but there's some theories floating around the fact that a lot of women get on birth control very young in this country. Birth control is like giving a young man anabolic steroids. It'll disrupt their own endocrine system. So that by the time that female is in their sexual peak between, the 20s, mid-20s, their testosterone is extremely low. I'm talking single digit numbers we see all the time. Giving them a little bit of cream and getting them into that upper range of 60 to 120 changes their entire life. Unfortunately, this hasn't spilled over to the academic realm as of yet. It is now starting to get there. Me and Gabby learned at the last conference, but only pockets of women and doctors know about this.
Okay, so these are basically the same testosterone deficiency symptoms as men: fatigue, lack of sex drive, pain, loss of hair, increased body fat, decline in arousal disorder, depression, etc. Viagra for women. There are actually some references, some studies out there that show that it can be effective. It improves vaginal, clitoral engorgement and lubrication. That's what PDE5 inhibitors do. They actually increase engorgement, not only of the penile tissue, but also the vaginal and clitoral tissue. 84% of success rate in decreasing symptoms of female sexual dysfunction, but it's not approved by the FDA for this purpose, but it can be prescribed through, obviously, compounding. What's the dose for women usually?
It's actually the same as men, 5 to 7 milligrams a day of tadalafil or 25 milligrams of Viagra as needed.
So we're not only, Viagra really is the best known, but tadalafil can also be provided, obviously. Vaginal atrophy, a decrease of 50% of blood flow to the vulva after menopause can be restored by estrogen therapy. Regular intercourse also maintains, when you're having vaginal atrophy, it's very hard to maintain regular intercourse. Other products, there's actually an approved product, a serum, that I don't know how well they're doing cell-wise to improve the atrophy issues and the dryness, and the DHEA. Can you talk about products that we have here that could deal with the vaginal atrophy and dryness too?
Absolutely. In fact, we just brought on a new medical science liaison that you guys will have the opportunity to meet probably in the next month or so. His name is Dr. Michael Critchman, who's an OBGYN and a leading female sexual health doctor. And we have a kickoff meeting next week with Sean and I. We're going to be expanding our making a women's health catalog. That's going to include a lot of vaginal suppositories, including DHEA, even diazepam, which is Valium, a benzodiazepine, some progesterones that can be inserted in a vaginal cream using the Pearl Toppy Click to help with not only vaginal atrophy, but dryness and pain, and then also libido. So we'll have, just like we have a urology catalog and a weight management, we are going to have a women's health catalog in the next 3 months that'll be very comprehensive and address a lot of these issues.
Okay. Before I move on, I forgot to mention these two booklets that we have from Clinic Optimizers. This one is about PDE5 inhibitors, which it has a bunch, and this one is about the penile injections. It also has a section on patient education, on a brochure basically to give patients. But
you grab a copy off my desk, by the way.
Yeah, we're going to try to produce more of these because they were very successful. And doctors love that, especially to give out to their patients too. Very hard to read, so don't concentrate too much on it. There are 3 columns in this table: medications associated with female dysfunction. There's a desire disorder, which I said that, the actual sexual desire; arousal disorder, which is staying excited, aroused while having sex; and the orgasmic disorder, not reaching orgasm. And these are the medications that may affect each one of those variables. And you have obviously amphetamines, you have antihistamines affecting arousal. You have statins and blood pressure medications affecting desire. You have anti-androgens or hormonal contraceptives, like you were saying, affecting desire. And I haven't seen the data on testosterone, but that's very interesting what you said. Tamoxifen, which is for breast cancer, affecting not only desire, but arousal. Contraceptives, even ultra low potency, affect both too. Psychotropics like antidepressants and benzodiazepine, anxiety medications, all of them affect, most of them affect sexual desire and arousal and orgasmic issues. Like in men also experience a lot of lack of orgasms. Aromatase inhibitors, chemo, obviously, and histamine, HA2 blockers, like for heartburn or even allergies can affect desire. So, as I said, that's why I said before, it's actually a miracle sometimes as we get, especially as we get older, because as we get older, men or women tend to take more medications for different reasons, okay? So the treatment for sexual disorder in women, and this was a really good reference I found, a really good review. As I said, there are some antidepressants treatments of sexual dysfunction. Wellbutrin has been shown to be good antidepressant because it doesn't cause sexual dysfunction, not in men or women. It's very stimulating, so sometimes some people don't like taking it because of that. Viagra and Cialis can benefit women with sexual dysfunction induced by SSRI or antidepressants in general. Female genital sexual pain disorders are complex, and they need basically a lot of psychological support too. Group cognitive therapy is also another thing that has been tried. Mindfulness-based interventions. Direct masturbation is recommended for lifelong anorgasmia. Anorgasmia is basically lack of orgasmic, reaching an orgasm. And as I said before in that special, I realized that a lot of, and these were young women too, were only able to reach orgasm by masturbation. Local vaginal estrogen therapy is recommended and preferred over systemic or oral estrogen for the treatment of urinary syndrome of menopause and related, basically painful sex. It's called dyspareunia. Vaginal dryness is a primary concern. Osphena is this drug that is also prescribed for painful sex, or what we call dyspareunia. Transdermal testosterone with or without estrogen therapy has been shown to be effective in the short term for low sexual desire. This is the only drug approved. It was approved in 2015 for libido in women. It had been declined once or twice before. A small company bought it, and a lot of women activists got involved. So it got approved eventually, which I was surprised, because it only really increased sexual intercourse by 10% in treated patients. And the side effects were, like dizziness. You cannot have alcohol with this drug, which really rules out a good date, really. I'm supposed to have at least a glass of wine to relax. And fatigue and nausea is a side effect. And Addy, so the company has this top things to know. So basically it's all related to the side effects. What works in a very small subset of women, Addy may cause sudden prolonged unconsciousness. Alcohol should be avoided when taking Addy. Hormonal contraceptives may interfere with Addy, actually increase the blood levels of the drug and cause more side effects. Addy may interfere with a lot of other drugs too. So this was made by the company because the FDA made them do it. So it's not, as you can tell, it's not a very fun drug it's not the drug that is going to solve this problem, but at least it opened the market. It opened the market for, once one drug is approved, companies say, let's go for that. Let's go for that indication, because now there is obviously one really ineffective drug that got approved, so that gives hope to other companies to look into. So there are other companies looking into different options. You may want to bring that up, the PT 141.
Yeah, absolutely. Yeah, there's a lot of drugs in development. One, as we know, there's doctors are starting to embrace androgens and testosterone for women, which again is a compounded option, not available commercially. But now you have several companies that are looking at different peptides. You guys are familiar with peptides in the form of Simorlin and some of the GHRPs and ACG that we make. There's all kinds of different peptides that do different things in the body. One of them is called bromolamotide, PT141, which actually is an analog of a hormone that you have in your body that determines skin color, melanotan or melanin. So people take that peptide, black market source to get tanner. A byproduct of that drug actually is PT141, which causes not just mechanical performance function in men and women, so blood flow to the penis, clitoris, and vagina, but also libido enhancement. And it works very, very well. And it's been on the black market for a long time, and other countries have used it. So I know several people have tried it over many years, and works very well. Now you have a pharma company in the U.S. who's about to, I think they're making it to phase 3.
Phase 3, yeah.
So they're about to bring it to the market as a new drug. Sean has actually found a source for the raw material, so it's something that we're looking to compound for urologists in the female market as well. Of course, we'll make it different than what the commercial manufacturing companies come out with, and that's going to be a blockbuster drug for women's sexual function and men as well.
There's some side effects too, but it says like flushing and
a little bit of nausea the first time you take it for about 10 minutes, but nothing too bad.
And you know why I don't want to talk about this product? Because I really don't have any data. But I just found out this morning that there are 5 different formulations of the screen cream. So I'm going to let Jason take over this one. This is one that's a little more complex because it has 5 components, or depending, 4 or 3, depending on the formulation.
So most compounding pharmacies make some form of this. It could be known as libido cream, female sexual cream, screen cream is another common name in the industry, but basically it's a combination of several ingredients that provide some physiological and some psychological enhancement in female sexual function. So some of the ingredients you guys recognize, sildenafil, which is Viagra. What does Viagra do? Viagra blocks the breakdown of nitric oxide, or CGMP. Well, the same thing works for female tissue, whether it's the clitoris or the vaginal lining fills with blood, and part of that blood flow has to do with their sexual function and the success of their sexual function. So things like L-arginine, sildenafil, those enhance nitric oxide, CGMP, bring more blood flow. Some of the other ingredients in there help with sensation, which is another important aspect. And then probably one of the most important ingredients would be the testosterone. It's vaginally applied. There's receptor sites in the vagina, just like there is in the penis, directly for testosterone to inhibit some action on increasing libido and function. Then, of course, some of that will get systemically and go to the brain, where the other receptor sites are located, that are going to increase not only that drive, but that desire to have sex and that response to sexual stimulation. So screen cream is very, very popular in these niche areas where progressive doctors and patients have discovered it, because again, there's nothing like this commercially. It's only available at compounding pharmacies, but it does work very well. And the reason I know this is I've worked at, with several compounding pharmacies over the last decade, and I've worked with several clinics that use it. I've talked to many, many women, or the husbands of the women that are using it, and it does work very well if it's applied, at the correct dose, or they apply enough of it. So, and this is a perfect example of a compounded product, something that you can't get commercially, that's completely customized. You can go to 10 different compounding pharmacies and probably have 10 different variations of this formula, different ingredients. It's very prescriber/consumer driven, which if you recognize in our other fields that we've done classes on, that's a reoccurring theme, that a lot of these products come from the doctors and even the patients that do their own research and get the doctors to prescribe these things. So it's a very interesting product. And I don't think here at Empower, we've maximized the opportunity, because we went to the menopause conference that I sent you guys an email on, and also the other pharmacy I worked at, they utilize a lot of this. There's a lot of women on this. So being that we came from kind of a men's health urology background as a company, and we're just evolving into the wellness female medicine market in the last couple of years, I think there's a ton of opportunity here, especially after going to the menopause conference and seeing how progressive even institutional OBGYNs are prescribing things like this and testosterone for women. So there's a whole new market for us to open up.
I've heard this question before, and I really don't know how to answer it. I'm sure pharmacists would know, but is the product edible?
Edible? Yeah. No, it's a topical cream. And the doses in there are low enough to where, basically, if you apply it topically, you're going to get absorption directly into the receptor sites in the area you apply, in addition to a little bit systemic. But when you eat something orally, it's got to go through the digestive tract and the liver. And a lot of the enzymes in that process will break down and negate most of the ingredients in there. Women do respond to oral PD-5 inhibitors. They respond to oral L-arginine, some of these ingredients orally, but you need a much, much higher dose for it to pass digestion and become systemic, whereas a cream will bypass that.
No,